Hi, I'm Clive Richardson, CEO of Akari, and I'd like to talk briefly about our eye programme. Now, this programme is in turn divided into two separate programmes. One, the surface of the eye, where namaquepan is delivered topically, and then a back of the eye programme where namaquepan is delivered by intravitreal injection. So looking at our surface of the eye programme first, there is a lot of preclinical data that confirms the role of both the leukotriene and complement pathway in surface of the eye conditions. And in particular, if, for example, you look at tear fluid, you see LTB4 levels are very heavily elevated. So our initial clinical study was in atopic keratoconjunctivitis, a severe form of dry eye, where we did a phase 1/2 study which demonstrated that namaquepan was safe and well tolerated by patients. So the next step now is we have an IND open in the States, and we're going to look to do a phase 2 study in another surface of the eye condition. Our second program is in back of the eye. And here there is again quite considerable preclinical work done looking at the role of namaquepan in a series of back of the eye models. What's so interesting about back of the eye is that the role in some diseases of complement is increasingly well understood, for example, dry AMD. But namaquepan, as we know, not only inhibits the complement pathway, but also inhibits the leukotriene pathway. And the leukotriene pathway also happens to inhibit VEGF. And VEGF inhibition is the primary form of treatment for wet AMD. So the opportunity here, or potential opportunity, is that in one molecule you have an ability to inhibit the complement pathway and VEGF as well, which may be particularly relevant to a disease such as dry AMD, where in addition to treating the disease, you want to prevent patients converting to wet AMD. So that's a clinical hypothesis, but in addition, we're also looking to ensure that injections are infrequent to the back of the eye, which is clearly patients' preference. So in our back of the eye program, we use pasylated namaquepan, which is a longer acting form of namaquepan with a longer half-life and a longer residency time in the back of the eye. And we're doing this work as we speak, and the hope is very much that this will allow a considerable injection interval. If you would like to learn more about our eye programs, either surface or the back of the eye, I'd encourage you please to explore our website. Thank you very much.